So I did my case study on varicose veins, and my name is Ashley Perkins. So a little introduction of varicose veins. These are veins that are swollen and twisted, and they lie just underneath the skin, and typically they occur in the legs. This common condition is caused by weak and damaged vein walls and valves. As you can see in this image on the right, this is a normal one-way vein valve system. Blood is flowing through to the heart, and there's this valve right here that closes right after to then prevent any reverse of the blood flow. But in a varicose vein, there is reverse blood flow due to the valve being damaged. So that occurs, like we just said, from weak and damaged vein walls. They may form whenever blood pressure increases inside your veins. So typically if you're doing any type of strenuous exercise, that can really increase the pressure as well. So common risk factors are old age, obesity, and pregnancy is also really common. So like we kind of talked about previously, veins have one-way valves inside them that open and close to keep blood flowing to the heart. This picture is a really good diagram showing that again, and kind of how a varicose vein looks within underneath the skin. So it has incompetent valves, and that allows for backflow, and then it causes bulging of the veins, as well as redness and tenderness. The veins can grow larger and become distorted, and that is what results in the varicose veins. Another little thing is it causes the blood to pool and then causes flow backwards, like we said, reverse flow, and that's called reflux. So varicose veins can be found in testicles, esophagus, stomach, liver, pretty much anywhere. They're just really common in the legs. They're mostly found in the legs because standing and walking increases the pressure in the veins of the lower body. So that's why we'll typically find them in the legs. Varicose veins are a common condition affecting 3 in 10 adults, and women are more likely to develop them than men. So I really liked this picture here staging the varicose veins and kind of the pictures that go along with it. They talk a lot about spider veins with varicose veins, which basically is just like the veins being more prominent within the leg and your leg looking kind of like a spider web. It can also lead to kind of nodes, like a bulging more severely and edema. And then it can also lead to ulcers if they're not treated and taken care of properly. So those are kind of the signs and symptoms: bulging, bluish veins, swelling, aching pain, feeling of heaviness, itching, and leg cramps can be common as well. So knowing all of these signs and symptoms, they can definitely limit the activities that you can perform and do. And the symptoms can get worse when you are just sitting or you're on your feet for long periods. So basically anything that's a lack of exercise can make it worse, but also strenuous exercise can make it worse. So kind of finding the balance between that when you do have varicose veins. Okay, so the doctor will diagnose varicose veins typically by asking symptoms and a family history, activity levels, and lifestyle. They're pretty common just to even take a look at your leg and do a physical assessment and determine whether or not you have them. But a lot of times doctors will also order imaging. The most common imaging is ultrasound with Doppler. Here we're assessing the size of the veins and the direction of blood flow, as well as to look for any blood clots, because severe varicose veins can actually affect deeper veins, which can cause a deep vein thrombosis. And the Journal of American Medical Association did a study that recently showed varicose veins are 5 times more likely to develop a deep vein thrombosis, so having an ultrasound performed with Doppler is really important when a patient comes in with these signs and symptoms of varicose veins that are really severe. So common treatment can be compression stockings, exercise for things that are, maybe milder cases. For something that's more severe, they might offer laser therapy, radiofrequency ablation. So it can just kind of range whether the doctor thinks it just needs to be minimum lifestyle changes, or if they need to go in and for a procedure to remove or close veins, or prescribe medicine. So the prognosis, obviously, it totally depends on what stage you're at within the varicose veins, but if treated properly, a great majority of the cases have a good prognosis even without levels of intervention for early stages of varicose veins. For severe stages, typically procedures have great success. So my case study is as follows. A 42-year-old patient who is female presents with large bulging veins and edema in both the thighs and lower legs. The patient was experiencing heaviness, redness, and thrombing in the legs as they took an assessment of her. She was an elementary school teacher, so her occupation required her to be on her feet for several hours on end. She would feel exhausted after the day and have to elevate them to find relief. So after performing the physical exam and taking her history, the doctor ordered an ultrasound to rule out any blood clots. So the diagnosis, the ultrasound results revealed a 7mm great saphenous vein that was completely incompetent, and it was directly feeding the visible varicose veins that were apparent in her legs. A little note too, the great saphenous veins are actually what causes most varicose vein disease, and it can only be diagnosed with duplex ultrasound or Doppler ultrasound. So the doctor advised EVLA or endovenous laser ablation to be able to treat that for her. And I liked this image here. I included it's a duplex ultrasound here of the leg, and you can see that there's a perforated vein that communicates with the great saphenous vein, and when they turned on the Doppler, reversed flow was noted. So treatment for this patient was endovenous laser treatment, which uses energy from heat in order to close abnormal veins. A laser fiber is placed into the great saphenous vein using a small cut in the skin. The area is numbed and a local anesthetic can be given. Then the laser fiber is activated, creating enough heat to shut down the vein and seal it. Which, just reading that, I think that's amazing, the kind of treatment that we have nowadays. It's insane. So if you're kind of more a visual learner like me, this diagram I included on the right side. So the laser fiber is inserted into the vein, the laser starts firing within the vein, and then the laser fiber is then removed and the vein is closed. And it greatly improves the look as well as like the function of the leg clearly from that picture. The overall success rate of EVLA is proven to be very high at 92%, confirming that this procedure is an effective treatment for incompetent great saphenous veins, with increasing follow-up though as well. So the prognosis for this 42-year-old female patient was compression stockings the first night after the procedure and daily for the next 5 to 7 days. The doctor advised her to be walking at least 20 minutes up to 3 times a day post-procedure because this can be tremendous for the healing process. However, concern is also intense physical activity and weightlifting following a procedure that should be avoided, and you should be cleared after any kind of follow-up to engage in those exercises again. For most patients, pain can be managed with over-the-counter pain medication, and bruising around the area can be common, which typically resolves quickly after the treatment in a couple days. So a differential diagnosis to varicose veins is kind of tricky. There are other diseases that can cause swelling in the lower limbs, such as the femoral hernia or lymphadenopathy, which is what I noted here. But typically when you do a physical assessment, varicose veins are easily identifiable. It's more of just the checking for any kind of like deep vein thrombosis or incompetent veins through ultrasound duplex, which is why that's commonly ordered with severe varicose veins. And then those are my references, and that's all.